going. We will reflect on your questions and the insights towards the end when Arundhati will be moderating the Q&A. Also, those who want to be added to the MHAI list and are not receiving our emails yet, please share your email IDs in the chat box. And if you haven't RSVP'd to this event. Also, we have participants joining us from India and outside of India. So I will request the discussants and everyone who is participating here to keep that in mind and share your insights, keeping in mind that we are talking about the LMIC context and not just the India context. So that will be. I'm going to give it a minute more because a lot of people are still joining. So just waiting for one more minute to let people join before we get into the presentation of the insights. But yes, please feel free to share your introductions as mentioned in the chat box while we wait for a minute more. Okay, so let's start. So we're going to be, the agenda for the day is essentially that we'll be sharing insights from the rapid survey that we did. And I'll be doing that for the first 15 minutes for you. And then we'll spend about 20 minutes getting additional insights from some of our partner organizations who've been working on the ground and who filled out the survey and had some interesting things to say. So we have organizations, representatives from organizations who've agreed to participate as discussants, and I will make those introductions shortly. This will be followed by a Q&A for about 20 minutes, which will be moderated by Arundhati. So for that, please share the questions that you want to pose to any of the presenters, or just insights or anything else that you want to share with the participants here in the chat box, and Arundhati will be compiling the same as we go. All right. Okay. So our panelists or our discussants for the day are Richa Singh from 9, Soumya Dabriwal from Project Bala, Lara Gulia from Tata Trust, Rikita Narula from Sachi Saheli, and Jaideep Mandal from Akar Innovations. Thank you all for joining us today and being here with us to provide you valuable insights. And of course, I'll be sharing the survey findings with you. Okay. So why did we do this survey? We did this survey to understand what are the challenges faced by partner organizations on the ground in terms of supply chain, and how are people staying in touch with their beneficiary communities, what are the challenges that they are facing in communication with the communities, and so that we can propose actionable recommendations to some of these challenges, both to our partner organizations as well as to government functionaries at different levels. In terms of who all responded to the survey, we had about 67 organizations who provided valuable information. Of those, majority were from India, but we also had 16 responses from Africa and 6 from other countries in South Asia and others. 54 of these are operating in rural and 49 in urban, so we have almost an equal split. So our insights are reflective of both. In terms of product focus, 23 organizations are working on access to disposable pads, 28 on reusable pads, and 13 on menstrual cups. And many actually have no product focus, so working on communication and outreach to the communities. 19 production partners, both centralized and decentralized facilities, and 24 organizations working on distribution and sales of the products. And interestingly, 94% respondents across all the regions are either currently in a state of lockdown or state mandated social distancing. And that's important because that has had serious implications on the supply chain of various products, and the ability to communicate with beneficiaries. And the beneficiaries that our respondent organizations are working with are primarily adolescent girls, women, but also girls and women with many organizations. In fact, 34 are working with girls and women with disabilities, 27 with postpartum women, and also others, which includes men, boys, and other stakeholders in the community. Okay. So this is a brief status of production, distribution, and access to products in the communities that respondent organizations are working in. 44 organizations who gave us information related to production units. 25% of them said that the units are currently open, 25% are not open, and 50% are working at partial capacity. In terms of availability of raw materials for the next 3 months, 1/4 again have raw material, but most of them either have partial availability of raw materials or have 35% have no availability, which is a serious concern for future supply of products as well. In terms of whether they can service the community demand, currently only 24% can service the community demand, whereas 46% can only service it partially, and 30% can't service it. So there is an issue of connecting with appropriate supply chain, appropriate service product providers as well that's coming up. And this is both for relief efforts and regular consumer demand. 18 of the organizations, 18 out of the 44 production related organizations are now actually engaged in mass production, and 11 are planning. While this is a great step, in the direction of facilitating access to PPEs for frontline workers and also community members, it begs the question whether this has actually impacted production of sanitary pads, of menstrual products, and if yes, then what are the alternatives that we can look at here? So this is one thing that we hope to discuss later during this session today. In terms of distribution, we asked our respondents what are the distribution channels that they were using in pre-pandemic times, so to speak. Most of the organizations, most of you, which is reaching out through community-based organizations, CBOs, 89%, and 61% through school-based distribution. Door-to-door, traditional retail, and online were the other channels. Given that these are primarily logistic-driven physical channels, 67% have paused normal retail operations, and only 24% are able to service demand. Half are only able to do so partially, and others not at all. From the side of consumers, we've also learned that many of the organizations tell us that 62% of the organizations have told us that regular channels for consumers have become challenging, so for accessing menstrual products, and 22% report that there's actually no access to menstrual products for girls and women in their communities. 52% respondents report an increase in demand as regular channels have become restricted, so they are getting queries for products now, but they themselves are constrained in the ability to service that demand. 58% state that local administrations are not taking any measures to facilitate access, but 19% are facilitating access, and we'd love to hear any examples of this as we go further into the discussion. So what are the supply chain challenges that are restricting supply of menstrual products and are going to be restricting supply of products in the coming future, in the foreseeable future? So one of the biggest things is that online sales have stopped. Few organizations within India, at least, were using India Post, which was still functional. But given that lockdown restrictions should be easing up soon, this should start to ease up. But currently, online sales is not an option, at least in India. And we'd love to hear from other countries what is the situation in the chat box and during the Q&A, if you can share your insights. Road transport restrictions, given social distancing, has constrained the entire wholesale distribution, and stock has been lying up in godowns, we are hearing from most manufacturers. While this has started to ease up again as logistics are coming back, It will have an impact on the cost of transportation in the coming future. So road and air freight are likely to be more expensive, even as restrictions ease up. New production is likely to be at limited capacity as the restrictions are being sort of eased up slowly. So social distancing norms are being applied. So you can't have many workers working in the factory at the same time. In the Indian case specifically, many workers have gone back to villages. So the reverse migration is having an impact on availability of workers. So both of these are impacting new production in a big way. As I mentioned, mass production may have also taken priority for some of the small scale manufacturers. So that is something that would be good to understand more if it's impacting current production of menstrual products. For SHG units, small scale producers, cash flow has become a big issue, and that begs discussion on the fact that what's going to be the viability of these units. And this is true not just for menstrual products, but for production of anything else that's happening through a self-help group unit or a small scale production structure. Import of products being restricted is also challenging, and particularly for menstrual cups, where a lot of product is imported from European manufacturers or American manufacturers, and raw materials for disposables, particularly wood pulp, is an imported material. So something to think about for the long term as well. So it's not just problems. We also asked our respondents to share insights on what are the alternatives that they have explored for relief efforts. And alternatives they have explored to address these supply chain challenges. And the responses were primarily from a relief perspective, because that's what most people are working on right now. So organizations are leveraging relief channels, both government and NGO channels. Some people are leveraging food distribution centers, which have been set up as also distribution centers for menstrual products. Government health workers who have personal protection equipment and are traveling in the community for surveillance are also being leveraged for distribution of menstrual products. But this also begs the question on them being overburdened and how much can we leverage their access to the community. Door to door within walking distance, so where staff are operating home sales units, they are being equipped to distribute products by some partners. Distribution of sanitary pads from dumped storage of government. So we are hearing across geographies that stock which was supposed to be distributed through schools, to ASHA workers, through other government channels, is lying unused since the lockdown was initiated, schools were closed down. So that stock is being leveraged by some organizations to be used for relief efforts. And these are some examples of what people are looking at as solutions as well. So this is one of our African respondents contacted Ruby cup manufacturers to find emergency cups for distribution, but the challenge is cost of importation and how to deliver them to Uganda. So logistics continues to be an issue. And for long-term solutions, so this is, I think, Jaideep from ACAR. They're working on import substitution, and he's going to be speaking more about this during our panel discussion. So in terms of community outreach, what are some of the things that organizations are reaching out to the community with, and what are some of the gaps? So most organizations we heard are keeping in touch with the communities, but primarily through phone and over WhatsApp groups. So 63% by phone and 55% over WhatsApp groups, which is expected given social distancing has been implemented. But 29% also through community workers and 22% through health workers. The key hygiene messages that are being promoted currently are related to management of COVID, which is hand washing with soap, social distancing, MHM in general, but also mask use. The gaps we found were, 50% approximately organizations are talking about this, but usage, maintenance of toilets, maintenance of cloth pads, and use of cloth pads. And these are extremely important right now, given that a regular supply of sanitary pads is restricted, guidance on use of cloth pad has become extremely critical, and that needs to be ramped up in a big way. Key messages targeted at men and community stakeholders on ensuring that wash facilities are accessible to women. So this is, everyone is in the community at homes, in whether you look at slums, villages, or all the men are at home. So even when a woman is going out to manage her or change her pad or wash a cloth pad, that becomes more visible. The wash facilities, whether they're in the households or in the communities, are more constrained. So engaging men in terms of providing access, keeping them clean, ensuring that water and privacy is available to women to manage their menstruation is also critical at this time. So what can be done? Since most people are using phone and WhatsApp, simple IC that can be transmitted through these platforms, and given that connectivity is an issue, should be something that we focus on. Audio messages, IVRS, posters, and limited size videos are ideal for this communication. And in terms of key messages, use of clean cotton cloth, because cotton cloth is going to be something so masks are also something that are being propagated by use of clean cotton. So how do we ensure that women are able to access clean cotton cloth for managing the menstruation? Basic guidance on folding and using, washing, drying, and storing cloth pads. Soaking and washing cloth pads for washing them, given the scarcity of water, because there is this thing of actually washing cloth under running water. So ensuring that we are reinforcing the messaging on soak and wash. Reaching out to, guiding the community that they should reach out to frontline workers in case of any reproductive health supplies or services are needed, for example, contraceptives, antenatal care services, and others. Also, given that there is a huge issue or added issue of water scarcity and lack of privacy, talking about RTI syndromes, given that there's likely to be poorer hygienic practices, is also important. And as I mentioned, masks are competing for cotton cloth, so ensuring access to cotton cloth is also becoming critical. So this is an example for Jatan, where they are taking help from a local textile trader for procurement of cotton cloth. This is for masks, but this is something that can also be explored for cloth pads. In terms of engagement with relief work, we are seeing that, most of our respondents are actually engaged in relief work. 30% are working with migrants, 23% with temporary shelters, 16% with quarantine and isolation facilities, and 45% with women in urban slums. And across these settings, we heard that challenges related to lack of menstrual hygiene materials, lack of water, and lack of toilets, clean, safe private toilets has become a challenge. So there is definitely need, and I think this is one big gap where we can have some coordinated advocacy with government stakeholders at different levels on addressing women's needs within the whole outreach of COVID that's happening currently. Especially for quarantine and shelter facilities, also high density communities like slums, and this is also important for minimizing transmission of COVID. So we need to ensure that we link that messaging when talking to our local administration. Ensuring gender segregated toilets with sufficient water and maintenance, also critical in the same breath, and ensuring access to menstrual materials is also part of this coordinated activities that needs to happen. The support requirements that our partners identified were mechanisms to include access to products and information with other essential services. So with the example of the healthcare workers, sharing of menstrual health and hygiene awareness materials. So this is actually an invitation to any of you who are developing IC materials on any of the key messages we shared to come up and share those materials with the network partners, because many have actually said that that's a big need and they will benefit from that. Guidance on how to reach particularly vulnerable groups within these settings, coordination to release government stock of products at various levels, at the district level, at the state level, in programs related to school distribution, through WCD and others, and engagement with large manufacturers on support are all areas of support that partners have cited. And anyone who can help on any of these aspects, please come forward and share that in the chat box. So I'm going to open, given this context and understanding of the context, I'm going to pose some questions to our panelists now and see what different folks are doing to try and address these challenges. Richa, you here with us?
Yes, I am, Tanya. Yes, Tanya?
Richa?
Yes. Can you hear me? Hello?
Yeah. Richa, can you hear me?
Yes, I can, Tanya.
Oh, okay. Sorry. So, Richa, in your experience at Nine, you have been reaching out to organizations to offer a product at subsidized rates in different geographies. How have you been able to address some of these supply chain challenges to allow access within this short term? And how can that help other organizations within our network in the foreseeable future?
Okay. Just wanted to check if my voice is clear and audible.
Yes, absolutely.
Okay. I won't say that I can't say that we've been able to completely overcome all the supply chain issues, but yes, we have in some way figured out a way to work. I'll just highlight the kind of challenges we've been facing. Like most of us, firstly, when we talk about sanitary napkins, not everyone realizes or understands that this is an essential. Even though the government has said this is an essential, the local policemen, the enforcement people don't often recognize it and do press us for a lot of e-passes or other issues, and they don't let the stock move forward. So there are pockets in the country where we have not been able to push through. I would say that as of now, 60% of my sales and supply chain is operational. And a large part of India continues to be without supply, and unfortunately, these are the smaller cities. So what we've done is we've tried to open up parallel systems. For example, medical wholesalers who don't always deal with sanitary napkins. There are two kinds of medical wholesalers, chemists and those in pure medical supplies. We've tried to rope in some of the medical suppliers to also carry our product. That has worked in certain areas, that has worked mostly in the larger cities. But the challenge one faces in the smaller cities, especially in India, sanitary napkins are sold in smaller cities and villages through a lot of cosmetic outlets and hosiery outlets, which are very women-centric. And these continue to be closed. So that's where the product is not reaching at all. And that's where we definitely need NGO support or the local government support to make sure our product goes there. So in those kind of situations, yes, a lot of organizations have come forward. For example, FICCI Flow has come, Oxfam. In certain states like UP administration, Punjab, the police department over there has come forward. And we've either supplied stocks at our cost, or in a lot of cases, they bought it from us at cost. So at hugely discounted rates to make sure that they can then supply it to individuals in these kind of situations.
Okay, so basically creating a sort of hub and spoke kind of a network in partnership with NGOs on the ground.
Right. And we do hope that as the government now laxes rules for non-essential shops, a lot of cosmetic outlets or hosiery outlets in smaller cities will open up, and we'll be able to start supplying over there.
Okay, and what about the supply chain challenges in terms of logistics, transportation, trucking? Have all those eased up, started to ease up now?
They have opened, yes. So we are able to move our goods from the plant to CFAs and big distributors. That is not an issue. The issue really lies in the second layer of the supply chain, from the distributor to the shop.
Okay.
We've also started production at our plant. Now we, in a way, were able to do a lot of these things because our manufacturing lies in a green zone. It's in Gorakhpur. So we were able to start. However, we've had to get the laborers from their villages and hometowns. So we've incurred costs for that. We've partnered with the local government to allow movement of our buses, and we're operating the plant at 50% capacity right now. The entire labor force is staying there in the plant. Now, there are a few costs that as of now, we've absorbed. The entire cost of moving the labor is all incremental, providing them boarding and lodging, those additional overheads. And also, transport costs have significantly gone up. There is a shortage of trucks and truckers. So we are paying anywhere between a 20 to 40% premium on certain routes to ferry our goods. Now, this is in the current situation. Now, what I foresee over the next 1 to 2 months, the cost of non-woven sheets as well. These sheets are used to manufacture masks as well, and they also go in the cottony field, sanitary napkins. These have gone up by 250%, so 2.5 times. This would lead to a significant dent in the pricing of the sanitary napkins. In addition to this, rupee is weakening. This is an entirely imported product. That will be a further dent combined with the logistics costs. So my fear is that if situation doesn't improve, and it's unlikely to improve because this is a global phenomena too soon, there is going to be either complete erosion of profits or a dent in consumer pricing as we move forward.
Thanks, Richa. That's really insightful. Jaideep, would you like to add in here, because you are also probably facing the same issues, but manufacturing at a smaller scale than Nine or any of the other manufacturers. These issues would be amplified at your level.
Yeah, we are facing similar issues, but in terms of local supply chain, because as you shared, the cost has gone up at least by minimum of 25 to up to 40-50% in terms of transport cost by all transporters. So, and then getting permission, for us, getting permission is also an issue for moving the raw materials and the finished products. While as in terms of imports, I think the two challenge which you already mentioned. So one is obviously the dollar price has been fluctuating, and now it has pretty high. So that has increased the cost of any goods which is imported, and also again the similar ways because logistics are still being hampered. So it's a big challenge to getting anything imported at the price which we have been getting earlier. So yeah, we are dealing with that, and I think on the contrary, so we have been working on indigenous materials. So we are trying to see how we can in our units we can use indigenous materials more vis-a-vis the important materials or the ones which are generally used for manufacturing. So we have in a couple of our units used jute based materials in eastern part of India, especially in West Bengal. We have also worked on bagasse, which is under final process of being used in commercial units. In our units in Africa, we have been using hyacinth and banana fiber. So there, I think hyacinth is still working fine. But as I said, I think focusing on alternatives parallel to what we have been doing, and maybe if we can do a good balance of between materials which are imported or traditional materials along with the indigenous materials, that combination might be a way forward in a longer term. But then that also needs to be seen in a practical viability financially, and also about the supply chain angle.
Sure. So the situation is actually forcing some kind of innovation to happen.
Yeah, totally.
Yeah. Okay. So given that this is going to be a constraint in the short term, that's pretty clear from what you shared, Jaideep, and from what Richa shared. I think cloth pad is definitely going to be something that we have to look at more intentionally, and how to incentivize hygienic use of cloth as an alternative. So Soumya, can I come to you now with a question? Are you here with us?
Yes, I am.
Hi. So Soumya, if you're promoting cloth pad as an alternative, either for exclusive use or mixed use with sanitary pads, how do we ensure that adequate cloth or stitched materials are available where needed?
Yes, thank you. Extremely important question that we need to address right now, because as you mentioned, there's been a huge shift towards alternatives such as cloth pads at this time, because people are trying to use what is available to them. And I come from Bala, which is an organization which completely focuses on reusables. So what we did was, the moment the first lockdown was announced, we divided it into two parts. The first part was ensuring the supply of the physical material, which, as you mentioned, the cloth pads, as well as cloth material to stitch, as well as the second part was ensuring the hygienic use of cloth pads, as well as stitching your own cloth pads at home. So it became extremely important to recognize that both of these things needed effort and needed to be focused on during, the month-long lockdown that has already passed. So for the first one, what we did was we tried to leverage a lot of community outreach network that we'd set up over the past 3 years. So it became a very mobilized effort through we reached out to points of contacts across different slums of India, as well as different rural communities we work in. We provided them with all of the knowledge and information that is required on stitching your own cloth pads, sanitizing cloth at home, and how to actually maintain and keep safe use of pads, which includes a lot of homemade remedies. Instead of using soap or detergent, we tried to get in textile engineers to tell us whether they could use lemon or vinegar, etc., and how long they should soak it for, where they should keep it, etc. So we built this repository of knowledge, which we then shared with different points of contacts across our community channels in the country. Then we had a huge stock of our reusable pads available. So initially we'd got 20,000 pads that we had available. And as Richa mentioned, as well as Jaydeep and you, as your presentation showed, there have been significant issues when it comes to logistics and transport. So what we did was recognize the high priority areas when it came to the refugee camps, when it came to urban slums where women and girls have extreme difficulties due to the social distancing. And they can't even dry their pads out very well if they stitch it at home, so they need specialized pads. So we identified the high priority areas and then provided that stock material to those women and girls first. Through, again, government tie-ups, we got sanctions and passes for actually sending our pads and transporting, etc. So we created priority zones, we created a repository of knowledge, and that really helped us. So whatever information that we started gaining from all of these areas, we collected that. And now we've created a video, a YouTube channel, as well as put it on our website, where we've put all the information on how to manage your period during COVID. This exists in 2 languages at the moment, only English and Hindi, because we work in Rajasthan, Delhi, Uttar Pradesh, the northern Hindi-speaking belt, and English. And this actually, we're redirecting people to go to the YouTube link, watch it. We've circulated all of the videos through WhatsApp in the communities, especially in the urban slums where there is access to cell phones as well as the internet. And that has really, really helped to make people more aware of how to maintain and use cloth pads in this time. Because, most girls were getting sanitary napkins in their schools through government distribution channels. And since the lockdown has been announced, there's been absolutely no service of free products. An interesting or an important thought here, though, is that all of our work has been completely free of cost for the community. So we led a separate drive to collect funds from corporates as well as individual donors. So we completely kept the financials out of COVID when we were trying to think of providing sanitary napkins. Because as you mentioned, all of the effort, the focus has moved to manufacturing of masks, has moved to how to wash your hands and keep yourselves clean. And the focus has shifted from menstrual hygiene, even from the organizations who are working on it. So it was very essential for us to keep going and keep doing. So this is how we managed to navigate. And yeah, if there's anything else that you'd like to ask.
Thanks, Soumya. That's great. And if you're willing, we can share the resources that you've developed with other partners. I'm sure it'll be useful for many, but only if it's...
Absolutely, no problem. Available on our YouTube as well as our website. We've also got these one-pagers. So we've got 7 different important topics on how to keep yourselves clean and hygienic during COVID and menstrual hygiene. And we've created 7 different posters of it also, which we're trying to circulate if people are not willing to watch videos, etc. So I'd be more than happy to share all of these resources with anybody who's interested and has access to the community at this point.
Great, thanks. Soumya, so if you can actually share a link in the chat box, that might be the first place for people to look at, but we'll also share it with everyone who's joined the call later. And yeah, some people are already requesting that. So I just want to point a question at Jatan. I saw Smriti was here from Jatan. Smriti, are you still here with us? Smriti, are you there? Okay, no worries. We can come back. But Jatan's been doing some great work in cloth mask manufacturing, and that's something that we can get more information from them. But
yeah, I'm here, Tanya. I just couldn't turn on the mic instantly.
Okay, great. Sorry, I'm just pointing it out to you just out of the blue, but how has it been your experience? Because you have moved, I think primarily to cloth mask production right now. So how do you see that in terms of cloth pad access in the community? What's been the experience?
So for us, I think the mantra has really been, catering to local market and grounding all our work locally. So we have women who are engaged in the production, who are all local women from, coming from the Basti where our production center is located. So, that is one. Then the second is all our material is coming from local vendors who have stocked up cotton, and they are also vendors from whom we purchase material for our cloth pads. So essentially, the material is pure cotton. We have targeted diverse vendors within the city, and we are getting our raw material from there. And local market is, has been big enough. And that is where we are targeting, because all the couriers and, we're not able to send products out. So whatever consumption has been there so far has been, local. And that is what maybe, is needed in the current situation, because that has worked for us. And now we have, the mask demand came in such huge numbers that, we were unable to cater to it. So we are doing it in batches, and we have engaged many other organizations who have tailoring groups simultaneously, and they are also stitching along with us. And we have now started focusing on menstrual cloth pads as well, which is our primary focus, and we are stocking up that as well. So once, we have an opportunity to send them, we already have pending orders, and we'll be doing that.
Great, thanks. And I know you have great IC for cloth pad stitching. You have videos, etc., for cloth mask stitching also. So it'll be good if you can share some links here in the chat.
Yeah, we have all. Sure, Tanya. We've created some videos, and there's some documentation in the government manuals that has happened for our masks and pads. So we'll be very happy to share all of that. Yeah.
Great, thank you. And I'll just like to point out here, Ina has been sharing some of those resources on the chat box. Ina from Wash United, they're a great knowledge partner they have been for us. And they've also compiled resources for both COVID and MHM during this situation. So please refer to that. She's shared that in the chat box. Okay, coming to Lara. Lara, you here?
Yeah, Tanya.
Hi. So, given that there's so much discussion on hygiene awareness, and Tara Trust has been working on the hygiene awareness bit through the MHM program as well as the WASH program, and it has emerged as a critical need, given increased dependence on cloth pads. So, what are some suggestions on messages and platforms, or reaching out with the same, particularly for rural areas, in your experience?
Okay, so as you rightly mentioned, most of our, 80%, 90% of our work is on MHM under the larger WASH portfolio that we are working on, and we work primarily in rural areas with marginalized communities. So right now, there is, like everyone rightly mentioned, that the cloth pad, and there is a huge lack of supply, which is not being able to be met. It's the same in completely marginalized areas where we are working. So what we've learned is women are now, basis on our interactions with the field, we've learned that women are resorting to, they shifting back to cloth. In that aspect, it's a good time to for us to help build their skills in cloth pad stitching, because cloth pad would still be a step more comfortable as compared to the cloth. That's what we've learned. And we're also looking, so we're looking at how we can build their capacities in terms of developing cloth pads. Also, we're looking at, along with the ongoing wash interventions, we are looking at messaging, delivering key messages in terms of hand washing, surface cleaning, and other things which we want to focus on. So the first thing, because our communities are primarily rural, we're trying to develop. We're working on developing a digital tool, which would be we're working with Jatan, and trying to develop animation or live videos of how to develop your own cloth pad as well as masks. And we are going to have to translate these into our 7 languages with multiple dialects, because so that we're working on that, and hopefully we should have that content ready by 3rd May before the lockdown is lifted. Additionally, in this, while we are looking at at least providing we have a team of 150 to 200 people on ground working in 25 districts. So we are providing them with good quality digital tablets or smartphones, which is our focus, so that once the restrictions are lifted and smaller groups can be met, for the women who do not have, the beneficiaries who do not have smartphones, we can have smaller gatherings and continue using our digital content along with our community resource people in developing their skills in terms of cloth pad stitching, mask stitching. And what we're also considering is we're working with the governments in 8 states. So the governments have been keen on setting up local production units of cloth pad and masks. So they want to engage the SHGs at a local level. So we'll be providing them with the cotton with the help of the government, and they are going to be developing these, and through PHCs and frontline workers and other federation channels, we plan to be delivering supplying these at the village level itself. But since our main focus of this entire program is primarily behavior change, so we have an entire MHM module which covers 4 or 5 sessions. So we are looking at identifying the key messages and digitizing all our content as well. So at least smaller gatherings can be continued to be reached once the lockdown is also lifted, with the key messages on how to manage the cloth pad as well, along with the other aspects of hand washing and surface cleaning. So these are the 3, 4 behaviors that we've identified, and we'll be happy to share also our content once we have it ready.
Great, that would be perfect. And I think it's also important to note here that so the content would also be in English, right? Not just regional languages.
It will be Hindi and regional languages.
Okay. Okay. So I think for those who are here from countries outside of India, please, whoever is sharing IC resources, please also mention if you have English or any other languages which can be used or adapted for other contexts as well. I think that will be useful. So, Lara, one more question. It's great. I think you guys are doing amazing work. What kind of platforms are most appropriate to reach out with? Is it phones? Is it WhatsApp messages? Is it posters? What's most appropriate? What have you seen with your COVID response till now?
Sure, that's great, Tanya. So actually, we've had an intensive campaign on, again, behavior change for our COVID relief effort. So we use different mediums. So we developed our own team videos. So that was one video. We used celebrity videos. We used animation films, and we used voice messaging and IVR messaging. So we've also collected a lot of feedback and databases on every medium that we've reached out to. So it turns out that IVR has a span of 80 seconds where people are listening to messages. Video messages from someone who's connected to you and you know personally is also working well. Animation films has turned out to be a great tool for us. We're also, and our celebrity videos, that has also helped us immensely in our COVID relief. So basis on these learnings, we are looking at using some animation and videos of recognized people in the communities to have the direct rapport with the community members.
Great. Thanks. Okay, so I'm going to move to Rikita, who's here with us from Sachi Saheli. Rikita, are you there? Rikita? Or Dr. Surbi? Anyone from Sachi Saheli? Okay.
They're both online, Tanya. I'll just call them and figure out. Just give me a minute.
All right. In the meantime, we also have members from the AKDN team, Aga Khan Development Network. Are you guys there? Can you unmute yourself, the AKDN team?
Hi, Tanya. This is Rikita. If you can hear me, I was unable to unmute myself at the time.
Okay, no worries. Okay, Rikita, so thanks. So you guys have been working primarily in urban locations, a lot in Delhi. So what are some of your suggestions in reaching out to women, particularly in urban slums, both with products as well as messages and platforms?
Thank you, Tanya, for the question. I think let me first talk about product, because that's something that we worked on in the last few weeks. So when the lockdown was announced, we had slightly shifted our focus towards relief efforts in terms of food, etc. Because we hadn't anticipated that the lockdown would go on for so long. So at the time, we raised funds and we donated ration items, and later on realized, especially when we worked in the areas of the areas that were affected by the Delhi riots at the time, Jafrabad, Mustafabad, all of these areas, we realized that there is also a need of sanitary pads there. And that is when we shifted our focus to understanding how we can get pads delivered to these places and other people like migrants who are adversely affected by this lockdown. So the challenge was to identify, first of all, the procurement of pads, because we have Sachi Saheli, I would like to here mention that works primarily on education or on menstrual health, and not really distribution on distribution of sanitary pads. So we didn't have a lot of stock with us, barring the stock that we had for the 5P pouches that we do, which I'm going to talk about. We didn't have a lot of stock with us. So we started exploiting our networks. We started talking to people. Dr. Surbi has a network. Dr. Surbi is the president of Sachi Saheli, has a vast network that she got in touch with, and we tried to raise funds. We tried to reach out to people for sanitary pads, and we were fortunate enough to get a good response, and we were able to collect about 50,000 sanitary pads at this point. We're hoping that we would get that much. Right now we've had donations from Pharmacy, Fiki Flow, and other agencies as well. So then we decided on how to distribute these things. What are the channels that we are going to leverage to distribute these? That was also a challenge. So we decided that since we didn't have any e-passes at the time or anything, we couldn't move out and we couldn't do it ourselves. So there were a few volunteers that we already knew, and who were working on ground. So through them we tried to do this. Then we got in touch with the district magistrates of various districts. We got in touch with them and we asked them if we could do anything, and they said yes, of course. There's huge need for sanitary pads also, so they allowed us, they gave us passes, and they also helped us with even using their transport in case we didn't have our transport. So we started with areas that were close to our NGOs, and now we're expanding slowly to other areas. And the channel that we're exploiting here are the ration centers and the food shelters. So we are slowly and steadily keeping sanitary pads there, and people and women who are in need of these pads, they can avail them. And What we've also done is at this point Sachi Saili had something called the 5P pouch, which had 5 essential items for period preparedness: pad, panty, paper bag, paper soap, and pad. Hello. Yeah.
Yeah, you're audible.
Okay. Yeah. Pad, panty, paper soap. I think.
Yeah, you've covered the 5 Ps. Rikita, you still there? Okay.
Hello. Yeah, I'm here. Okay, so what we did at this point was continuing. What we did at this point was we updated the 5P pouch into something called the COVID kit. And the COVID kit then had, of course, we tried to put, instead of 1 pad, we tried to put at least 12 pads so that people could use these pads at least monthly. And then we also replaced the paper bag with we also had masks in these, so we're trying to get as many masks on board as possible. So these COVID kits are like a complete kit at this point to help women manage their periods, and at the same time also protect themselves from COVID. And we also put, instead of the paper soap, we put paper soap bars. So this is the channel that we are exploiting at this point. I would also urge people who are engaged in relief work to exploit government channels instead of making their own machineries, because there are machineries in a place at this point. And if it's possible, we could exploit those channels. And in terms of communication, WhatsApp, phone calls, and social media is something that we have used a lot. We've been getting phone calls from from girls going to schools, because our communication with them was completely cut. But considering that they had our phone numbers, they could get in touch with us, and sometimes they'd need advice. Sometimes they'd come and tell us that they need sanitary pads, so we would direct them to the nearest points that they could get sanitary pads, where we are already distributing. So another thing on social media is that we're doing is we're making infographics at this point, infographics that are easy to understand with pictures. Currently they are in Hindi. I'd be happy to share my our social media link here, so that you could maybe have a look, and if these infographics are of any use, you could use them. And and currently these infographics are on COVID, but we're going to shift our focus now to giving information about managing periods at this point through infographics. And if that would be useful to you, I'd be happy to share them here.
Yes, Rikita, I think that would be really useful. Any resources that you guys can share in the chat box, that would be super useful. I think an important point you mentioned was engagement with local administrators and leveraging existing government systems. And I think most government functionaries are so focused on the COVID response and surveillance efforts that this is not even on their agenda right now, but maybe a conversation will bring it on the agenda. So that's something.
One more thing that I forgot to mention here, that we also, for communication, we also leveraged radios, radio 91.1 FM and Ishq FM. These we've had some relationship with them already, and it's good that they've been talking about issues such as this, and so we were able to reach a larger audience, and we were able to talk to them about how you can manage periods at this point, and we also appeal to people to donate pads at this time, donate masks at this time. So that's another medium. If we could maybe foster our relationships with radio channels, that's also another medium to reach out to people.
Right, absolutely. Yeah, thanks for that suggestion. Also, I think one role to play for anyone who's willing is also the role of an aggregator. And I think Arogya Seva has been making an effort in that direction. They've compiled a sheet where they're trying to put together any requirements of product for relief efforts. And Autumn Eastman, she shared the link in the chat box. So anyone who has that, has any requirements for products, you can please go ahead and put your requirements in that sheet, and they can try and connect you to any providers. And providers like Richa and others who actually have stock available right now in the regional clusters. So yeah, thank you. So thank you to all our panelists. I think this was great. I'll just refer to just Karthik also mentioning they have Real Relief has supply for cloth pads, and I think many others have were mentioning in the chat box. I'll just go back to Aga Khan Development Network and ask Sudhir about what they have been doing in the rural intervention areas on messaging around MHM and related hygiene awareness.
Yeah, everybody, and my name is Sudhir. I work with Aga Khan Development Network, and I am based out of Bahraich district in Uttar Pradesh. And most of the points which were covered regarding menstrual hygiene, we have observed in our field area also. Because right now the priority of the government and most of the CSOs has been on the COVID-19 response, and somehow this MHM has taken a back step, and accessibility to products, sanitary products, is a major challenge being faced by women in our area. And we have right now we have initiated manufacturing of masks through SHG members in our area. But I think if we find some resources on especially cloth-based sanitary pads, that is an area that we can explore, and it will give accessibility to sanitary pads for the beneficiaries in our area, and it can also lead to a source of income for our SHG members and the vocational center members. I would also request my colleagues who are on the call, Nirja and Arka, if they would like to share something more. So this is primarily work that we are doing with regards to the MHM. Plus, there's a lot of information dissemination being done by our field team. And some of the points that were raised during this call are really valuable, and we'll try to incorporate them in our response.
Great. Thank you, Sudhir. That's good to hear. So we are actually coming to the close, and Arundhati, I think we can take the next 10 minutes to, we'll be running a bit over time, but can we take the next 10 minutes to look at questions that came up, insights that came up in the chat box while we were talking through all of this? And thank you to all our panelists for their wonderful insights. Thank you so much.
Yes, thanks to everyone. Just some quick acknowledgements. We'd really like to thank everyone who took out time to respond to the survey. These insights would not have been possible, and the recommendations would not have been possible. Also want to thank WASH United, the Reproductive Health Supplies Coalition, and the African Alliance for MHM, who helped us develop this and have also promoted it in other countries. So we have several people from other countries as well. Just to very quickly summarize, we have several organizations that are doing IEC support in general, but also specifically during this time. And they have IEC resources in different formats and in different languages. I just want to call them out, even though they've put themselves on the chat box, just as a reminder. There's Sukhi Bhava, Maina Mahila Foundation, while they, I don't know if anyone's present, but they are developing IEC materials. There's Bala, Ratan Sansthan, Tata Trust, Sachi Saheli, for sure, that are looking at various types of IEC, including on hygienic and safe use and maintenance of cloth pads. We have a resource list that's being maintained by Ina at WASH United, and she shared that link. So you can refer to it, but also add your resources to that link. We'll share all this after the call. We have several organizations that are involved in product distribution and product support, both disposable sanitary pads as well as reusable. And these include 9 and Richa was on the call. You can reach out to her. Akar Innovations of Jaideep, Bala, Jatan Sansthan, Fulcrum, based out of West Bengal, Real Relief, and some others. These particularly. There are other organizations that are present on the call that are willing to extend support in various ways. SR Foundation, Nitisha is there and she's put her email on the chat box. So please do reach out to her for support. Ekant from Triggerize has also been asking for opportunities to partner. And Arogya Seva, as Tanya mentioned, is also looking at kind of pulling together who is in need and how can they connect people in need with those who have resources to give away. Very quickly, in terms of some of the key things that have come up during the call, some interesting ideas for providing access to regular sanitary pads as well as cloth pads. So with regular sanitary pads, Richard talked about the interesting way of how can we work with medical wholesalers to carry sanitary pads. While this may work only in large cities, it's still something worth looking at. What would be interesting to do and important to do, especially as restrictions are easing up, is to identify manufacturing units in green zones, those that are not at high risk or do not have a high caseload of COVID-19 patients. So how can we look at kind of invigorating those manufacturing units in green zones and then using like this hub and spoke model to reach out to communities as well. All of you have done this in the past, but then as we're easing up restrictions, look at how we can reach communities through more female-focused retailers and leveraging self-help groups. Okay. For cloth pads, it seems that there is a fair wealth of information and resources on making cloth pads yourself at home. They made safe use and also safe and hygienic maintenance of these pads. So we should refer to those resources. Are there ways in which, given that there is a shift towards mask use that is likely to continue for the coming months, how can we ensure that those production units continue to produce masks, but also how can they receive cloth to manufacture and distribute cloth pads? The government, someone mentioned, I think it was Lara from Tata Trust, that they are keen to establish units, especially though it may be focused on mask use. How can we leverage those government contacts that many of us do have to ask that cloth pads be manufactured in a hygienic way alongside masks? Various communication tools have been talked about, which include digital tools, which many organizations have, but also videos, voice messages, IVR, animation films, the use of radio, mainstream radio as well as community radio, and using self-help group members and frontline workers to provide messaging. So both direct as well as digital forms of communication. And lastly, an important point on how can we leverage our the rapport that we have in different states, in different cities and different rural areas with the local government to be able to ensure two things. One is ease up supplies or encourage manufacturing of both disposable pads as well as reusable cloth pads, and then encourage the communication of essential information, IEC, on menstrual hygiene during this time. So these are some of our key takeaways. I'm just looking at the chat box. We have a number of questions, comments that we have. I'm just looking through this. Okay, so these are the main things. What we will do after this call is we'll make sure that we're able to email all of you with the presentation that was made, as well as identify those who have ICT resources to share products, as well as those that are in a capacity to extend support or connect you with those people who may have resources to directly support implementation. So again, I'd like, on behalf of MHAI, we'd really like to thank all of you for joining us, for spending your 1 hour with us this evening. We'll make sure that we're able to get back to you quickly so that you can actually implement some of these great recommendations that have come. Please do email us with your solutions, your stories of what's worked well. Also, please reach out if you want to connect with others or if you need to connect with others. We do our best to connect you. So Tanya, any other closing comments from your end?
Thanks, Arundhati. That was a great summary. I'll just say, again, thanks to all our panelists for joining us and sharing their insights, and those who were on the chat box sharing their insights as we were having the discussion. Just one thing, if you want to receive updates from us, please leave your email in the chat box. We will add it to our list, or even the resources that we spoke about. And if you don't want to receive updates and only the resources, you can mention that too. So please leave your emails there. Thank you so much. We will leave. We'll stop the call, but we will leave the room open for you to share your emails or anything else you want to, or connect with each other for the next 5 minutes. Thanks and good evening. Bye.
Thank you so much, Tanya and Arundhati.